Hello, everybody. Welcome. This is our new biannual Workforce Development Team Science workshop. We're going to show you all of the different options that you can learn about team science and other things, because clearly teamwork in research is a competency that requires an all kind of work. So it's a skill that you can apply to basic science, clinical trials, collaborations. So that's an essential tool that people can learn and benefit from. So there are lots of other topics you can move on. The Team Science series is now presented by the Workforce Development Core. It's folded within all of the training opportunities, and we partner with other cores on clinical trial support, teamwork, engagement. So all of the materials you will see presented under Team Science is collaborative. It has competencies that align with all the other CTSI cores. So you'll see our folks, Liz and Catherine, run most of the other workshops. So you can ask team questions there as well. This is just for you to know what's going on this semester. This is on our website, so you can always check which new workshops are available in the schedule, and the links are presented. You know that most of the materials that presented by our core, by Workforce Development, I recorded and posted on CTSI YouTube. So if you missed something, want to see it again, want to share with somebody, it's always there. Again, if you never really appreciated the extent to training and resources that CTSI provides, this is our comprehensive map. Not all of the workshops are offered every year, but what's not offered this year, you can usually watch the recording from the previous year. And if you have any questions about any of this information, please reach out to Catherine or Liz. Most of the workshop these days are on Zoom, so you could attend from any place, but there are a couple that's still only offered in person. A couple other things. As in the past, we offer certificate of completion to the folks who finished the entire series. So this series that starts today has 3 sessions posted here. If you need certificate of completion, please reach out to Liz after you finish. We keep attendance for everybody, so you don't need to tell us. We know that you attended, and the certificate will be issued to you. There is also now a micro-credential or digital badge developed on translational teamwork. So the difference between workshops we all attend together. We talk a little bit in person, but mostly it's me talking and sharing some knowledge with you. The badges are entirely yours. This is your independent work that you do on your free time. You will receive an assignment that you're going to complete, and we're going to grade them and tell you when you matched and received the competencies for the badge, and that it'll take you one day or take you a whole year. That's really up to you. And then if you have interest in the digital badge, please reach out to Catherine after you finish the workshop series. And Catherine is here on the calls on Zoom today, so you can text her with any questions. For those of you who are interested in CME credit, it's also available. You'll have to submit your information. And here we are ready for today's workshop. So as I mentioned, this workshop this year is a series of free workshops where I interview experienced investigators and administrators who work on research teams and other kind of teams. And they talked about and shared experiences, strategies, and challenges based on their teamwork in specific settings. So today our guest will be Jill Szczesek. Jill may join us later, but I'm going to use the pieces of recorded interviews, and you received the link to the entire interview that you can watch to better understand the context of some of the messages. So this is not a beginner workshop on teamwork. I hope most of you have some foundational knowledge about teams. If you do not, our previous series are recorded. The last time we talked about teamwork was in 2023. And you can refresh all those concepts. Today, we're going to talk about unique applications. So not just how teams work, but how unique teams work in different settings. So Jill is going to talk about teams in big science. Big science are really large research collaborative that involve industry, academic partners, non-academic partners, contract researchers. So these are the teams that could include hundreds, several hundreds investigators from multiple organizations. And Jill has many years of experience helping run those big science collaborative. Next month, we're going to hear from Dr. Sharon Huner, who is a faculty at the School of Nursing here at UB. And Sharon's going to share many years of her experience working in what we call a socio-technical innovation, using innovative data science approaches to improve care delivery across multiple settings. So medicine, community settings, behavioral services, social services, how to bring them all together, how to partner with clinicians outside of academic medical centers, and what are the unique challenges that that you may experience if you're working in this kind of collaborations and how to address them. And then finally, we will hear from Dr. Gloria Aidoo-Frimpong, who is a faculty in the School of Public Health and Health Professions. And Gloria's experience is specifically working with international partners and agencies that address sexual health and minority health and HIV issues. And what does this kind of collaboration look like? How to prepare for partnering with these organizations and how to avoid some of the pitfalls that Gloria is going to share with us. And at any point, feel free, if you have comments, questions, feel free to put them in the chat. Liz is monitoring them for me, or I don't know, how many people do we have? We can probably okay to just ask. I can't see you if you raise your hand, but you can just ask a question and hopefully I will be able to respond. Okay. All right. So today, we want to focus on two specific objectives. So we want to talk about best strategy to support big science teams. And figure out which approaches work better depending on the stage of a team, research discipline, size of a team, etc. And then the second objective is to really understand what kind of roles and skills are essential for running this kind of teams, big science teams. And without hearing from you all, I assume that most folks on the call today are researchers and investigators, but it would be great to hear from people who represent other fields like research administration, finance, clinical support staff, compliance staff, who are also very, very important members of any research team. All right. So before we start talking about teams and get into specifics, I want to emphasize that not every project requires a team, especially interdisciplinary team. There's nothing wrong with doing science alone in your office or in your kitchen, if you can do that. It's perfectly fine. You may save yourself some time. You may be more comfortable. You don't have to argue with anybody. You don't have to share your very limited budgets these days with other people. It's a good life. But there are a lot of questions and a lot of disciplines where working alone is not doable anymore or not even possible. And so if you're not somebody who normally works in teams, my goal today is not to convert you into team worker. That's not the point. The point is to give you the tools if you have a project or if you join a project that is a team-based project. I want you to be successful, I want you to be productive, and I want you to have a great experience that will enlighten your colleagues, enrich your teamwork, and also be a positive experience in your professional career. So anytime you trying to decide, why am I dealing with all these other people? Why can't I do it alone? Then look at this diagram or any other kind of diagram. If you have all the expertise you need to complete your project, then you can continue working on it and don't spend any time inviting other people or spending resources on building a team. You will be successful, you will publish, apply for another application, and it'll be perfectly fine. For those of you like me who can't do all the work alone, if you need a team, that unfortunately doesn't mean that you can jump right into the research. There are a couple other phases that any normal team will need to grow and mature to the point when it becomes productive and can perform well. Some teams able to reach it within 15 minutes to half an hour. Some teams will take years gelling, trying to get used to working together, and people will break apart and go do their own thing and then combine their efforts together. So there are different team dynamics, but it's very short-sighted to pretend that those phases, norming, storming, discussing, arguing, adding some people, taking off some people from the team, that those phases don't exist. These are real phases of any productive teams, and they have to take place, and we need to allow for those phases to take place. So and sometimes people say, well, how can I build a team if I only have 4 weeks from the time the grant announcement goes out to the time I need to submit? So that's a real challenge, and we're going to talk about that. And that if you're in an environment where funding opportunities show up on a 4 weeks notice, it's very important to invest into building your teams even before you know there will be a program announcement. Because again, those 4 weeks will probably not be enough for you to write a competitive proposal and build an effective and trustworthy team. So teamwork may be happening in your life regardless whether you're writing a proposal or not. Selecting and adding people to your team, and you may be a part of multiple teams. But so let's jump right in and get into some details. Is Jill on?
She has not joined yet, no.
Okay, so then let's hear from her.
My name is Jill Szczesek, and I'm Associate Vice President for the Health Sciences, specifically focused on research administration and finance. And prior to coming to the University of Buffalo, I was the Chief Operating Officer for Hoffman Woodward, which is now a part of the university, which is a really good step forward for both organizations. And during my tenure there, I was also the Managing Director, and I led the submission for a very large and complex NSF proposal, a Science and Technology Center, for approximately $50 million. And so I led that effort as the Managing Director for about 10 years. My background is, very higher education oriented from an administration vantage. However, my doctoral work, my PhD, is really in science policy.
All right. So Jill is our guest today. So let's hear from Dr. Szczesek now about what she perceives the benefits of large interdisciplinary teams in big science.
Many investigators, especially if they've gone from the stage of running an individual research program to being able to coordinate a center type opportunity, They're unfamiliar with the navigating or negotiating specifically of budgets. And that is something that people should tap into research administrators for, because when it comes to scaling up a budget from what they might have typically seen with an R01 from 3 million to what now might be 60 million, 20 times scale, every institution is going to want a piece of the pie. And so you really need a skilled administrator, and you can have a vision for it, but you need to sit down with somebody to frame out a budget so that you understand where all of the parts will be disseminated. Yet at the same time, I can say from personal experience that upon renewal of a center that I used to run, I represented an institution that had an over 90% indirect rate. And you would think that that might be challenging upon renewal to negotiate with partners. However, good conversations between administrators and leadership led to that budget not being distributed any differently, that budget being equal to what it had been before. And this was a total cost budget, frankly. This was not NIH. This was a total cost. And having good relationships with research administrators and other investigators to understand how to break those budgets down are really, really key. So I would just say that when you're going into something like this, and if you're going to be scaling up to the extent that you are, tap into the resources that are available.
All right. So let's regroup and think about what the example that we heard from Dr. Szczesek. And I answer a very simple question just to get started and figure out how to use this setup. So simple question, true or false? To become a rigorous and successful scientist, trainees must master every aspect of research and scientific methodology, including research compliance, budgeting, grant writing, study recruitment, study coordination, statistical analysis, qualitative and laboratory science. So do you think that's true or not? All right. Okay.
Also pasted the link in the chat in case anyone is not able to use a QR code. They can use it on their computer.
Thank you, Liz. Okay, 7, 8. All right. So everybody is absolutely correct that you don't have to master every single aspect. What do you do? Speak up, folks.
Form a team.
You form a team, right? Anything you heard from Dr. Szczesek that struck you as not a common practice, at least in your department? Her team had access to an experienced administrator, right? So they knew where, or at least they knew where to find one. And so many junior faculty struggle with that phase. They think, where am I going to find somebody who gives me enough time? It's not really, I don't have time to build relationships. I'm not important enough on the food chain. The administrator doesn't talk to me. I will try to do it all alone. So this is one of the challenges that we want to address, whether we administrators or we are junior scientists, is to recognize that you always want to play for your strengths, play to your strengths. You don't want to be doing work that somebody else could be doing. And so recognizing that and early on, either through negotiating when you first considering the job, to make sure to ask about all of these resources, or even to know what to ask, and making sure that the expertise is available. So let me show you. If you attended any of our foundational talks on team science, you've probably seen this diagram that sort of provides a skeleton of a successful team. The trick here that the same people can fit into multiple of those categories. So somebody who is a team leader could also be an expert in a specific area and could be a great communicator, but maybe not such a good coordinator and somebody who doesn't schedule a meeting. So it doesn't mean that you have to have at least 7 people on a team, but what's important is that all of this important function of the teamwork are addressed, because if you don't have that expertise, your team will start limping. Most of the time we're aware of scientific expertise. Okay, you need a biostatistician, you will find a biostatistician, but recognizing other important priorities. So do you have somebody who understands the budget for the specific grant? Do you understand somebody who understands compliance requirement for these funding organizations? So recognizing that all of those are also important competencies and knowing where to find those people and how to work with those people. So let's hear another segment from
Dr. Noyes, I'll be honest with you. I am so proud of the time that I spent with the team that I did over the course of almost 10 years and getting to the scale that they did. But at the same time, administrators, we can support all day long, but the science has to be strong. So we have to have, every project has to have somebody who has a vision and who knows how to put the parts together. And we can help with filling those in. If an investigator is saying, I need somebody in biochemistry to do this, we can help with those things. But at the same time, we really need the science to be strong and an investigator to come to us with a vision that basically sets a map out or sets a, charts a course. Dr. Noyes,
Okay. So let's think a little bit about what Jill said here. So how do we build an effective and successful team? What are the key factors, or maybe the most important factor that that can help us with that? So should the team have shared goals, priorities, and vision? Should the team have expertise, people with a similar expertise so they can talk to each other and communicate with each other? Should you be working with people who you're already familiar with, because then you better understand how they operate and you don't need to negotiate and navigate as much? Or the opposite, should you identify new colleagues that you never worked before so your team is the most innovative? And those answers, by the way, are very common strategies that a lot of people use when they're trying to build a team. So, of course, you are all experts in teams, and you provided the most appropriate right answer, which makes me very happy. Anybody want to comment why the other answers are not going to lead to success when it comes to teamwork? Anybody had an experience maybe, or want to share a story? Is that your experiential learning, that you tried all 4 of them and only A worked, or that's your intuition?
In the chat, we have poor communication.
When does it happen, when you have a poor communication? When it's most likely to happen?
We have setting goals and vision.
Hi, this is Karen. That was my comment. Just in some past experiences that I've had, if the leader of a team is not clearly communicating goals, priorities, objectives, and their vision, then the entire team really doesn't know the path that we need to take, and things can fall apart.
Yeah. Thank you, Karen. This is a very good comment. And so there are actually two comments in one. So one comment is that, yes, it is very important to have shared goals, so everybody's moving towards the same objective. But that the other thing that Karen mentioned is that it's really a responsibility of a team leader. And maybe that's how team leaders really determine it's somebody who has clear vision. Is that right, Karen?
Correct. And in order for everyone to have the shared understanding, it has to be communicated properly. So if we don't have it communicated properly where we can all buy into it, then we're not starting out very strong.
Yeah. Anybody else want to share their experience or?
I'll comment that
Yeah.
I really like to have that priorities discussion with a team. I find if you don't do that and you start to get lots of incoming requests, everyone gets frazzled and it's a bad situation and it can contribute to conflict. But if everyone knows what the key priorities are up front, and I like to do them either quarterly or biannually, because your priorities might change, right? Depending on funding. But that piece has been really important to me, and thinking more in terms of vision, this is going to be helpful for me.
Very good. And priorities can change on Monday. So it's the frequency of those meetings. Yes. And so I want to ask another question related to this. So Karen suggested that the team leader should really determine the strategy or objective. But what if somebody else on the team have a better strategy or an idea to reach that objective? So what is interplay between having your leader to announce your direction and the expert, because the leader may not be expert on all of the areas. So when do the leaders lead, and when do they listen to feedback from other team members and other experts on the team? And I think, Dina, you were kind of leading in this, in the same direction. So you may have too much feedback that will get noisy. So how do we handle, or how do we distinguish the useful and constructive feedback from the team, and not run into the situations where team perceives it as a lack of leadership?
Sometimes I'll use the suggestion box concept, and if someone has something that's interesting but maybe not super beneficial at the moment, well, let's put it on our list of things to consider in the future so that it's still there. And I found having that list, I mean, sometimes the situation evolves and it's like, oh, let's implement this strategy.
Yeah.
This is a good strategy. I'm glad we had this in our pocket.
Yeah, and so perhaps the goal should be determined in the beginning, because the composition of the team will probably depend on what the goal is. And then the approach of a strategy or everyday activities would include the feedback from people who are most affected by those activities. So, but giving people the sense that they are contributing, that they own a part of it, because the shortest strategy is to demotivate everybody, is to take away their authority and their ability to contribute, and says, do it what I said. And so the whole benefit of a team, that if it's well run and well designed, people come with internal motivation because they feel appreciated and they feel that they're contributing. So finding that balance is very important. Clear vision, flexibility, and ability for everybody to contribute where they have expertise and valuable feedback. Okay, let's continue. So I also mentioned earlier that you can't really start become a productive team on a day one. That's pretty much impossible, again, because of the time it takes to have those discussions. I can send you my email with my vision, but it takes time to receive feedback, and it takes time to negotiate in the situations where we don't have an agreement or where there are multiple alternative strategies. Or you may go back to the drawing board and say that, well, given what I just learned from the experts, maybe my vision needs a little bit of correction. So having that built-in flexibility to circle back and bring additional level of expertise, that becomes very useful early on before we actually buy all the important equipment and deliver what we need to deliver. So that's another place in a team's life or team's history where leadership and vision, who needs to stay and who are we missing, could be very important. And to me, that's a responsibility of the leader, because nobody else really should have a responsibility to hire an additional person or take somebody off the team. So this is what leaders do. But the selection of a new team member, selection of expertise, may be a team effort. Any thoughts and comments on that?
Dr. Noyes, can I chime in?
Of course.
One of the things that I've seen, frankly, is that vision is critical. And so as long as you have a leader that has a vision for what they're hoping to accomplish, all of the other things come together as long as they know how to put a team together, just like you're mentioning. And yeah, these are definitely stages within, but when it comes to the space that we're all situated in, like, somebody has to have a vision for where they want to go.
Thank you. So let's continue. All right, so let's talk about what kind of characteristics or what kind of skills a successful team needs.
I think that an investigator in different scenarios, when you're talking about $50 million awards, $100 million awards, sometimes the terminology changes. So it's not going to be the PI. It's going to be the managing director or the scientific director. And, every agency uses something a little bit different. Is that person has to have an understanding of the fact that this is not a one-person shop, and they have to take the lead, but they have to learn how to delegate and trust. And yes, they need great administrators backing them up. And from the proposal standpoint, I think every institution, when they know that they have an investigator that's going after something significant, they need to put every resource that they can behind them. And this is not something STCs, OTAs, they don't come out of just one shop. They have to be a team effort. And so the institution needs to recognize it, and the PI should not be afraid to go to the institution to get the support that they need. However, the only thing that I would say is that as long as the PI is well prepared and has a plan in place, the institution will support. And I'll tell you a lovely story about somebody who he's passed now, and I smile when I say it. And he was an investigator that had the whole package put together. He knew exactly what he wanted to do when he missed a deadline.
Yes, so we've probably all seen this before. So what stood out for you from this example that Dr. Szczesek has shared? Does this correlate with your experience of successful teams? So what I've heard her say of several interesting factors that or strategies that team use to build towards success. So I keep hearing you say institutional support. And again, we're talking about big science. We're talking about large projects that require a lot of people, significant infrastructure. And the institutional support here could mean anything from permission to hire, to space, to quickly bring in a consultant who can write or proofread or develop beautiful imaging for the proposal. So there are lots of opportunities that we as investigators don't have every day, but may need them in a special situation. And then another thing I've heard that I thought was very important is this trust that the investigator or PI or project director really have to trust their people. If you delegate, you have to trust their results. When you start micromanaging and overlooking the shoulders, first of all, you will not have enough time to do all that on your own. You're not going to run a big team if you can't delegate, or if you delegate and your people cannot deliver. And then, of course, several people mentioned early, you may get too much feedback, and you have to be able to tease through it and distinguish the feedback that's meaningful and going to help your team from the feedback that perhaps could be saved for later or maybe not that helpful to begin with. So all of those strategies may be very helpful in some situations and potentially not very helpful in different situations. So I would like to hear from you what you think. And maybe you heard something else in Dr. Szczesek example that I missed. So please feel free to bring it up.
I'll share an example of one of the best teams I've ever worked on.
Yes, please.
It was in graduate school at a marine lab in South Carolina, and we worked on a boat. And there was
That sounds good already.
a crew of 5 of us, and we had a grant from the EPA to sample all the estuaries up and down from like Myrtle Beach down to St. Augustine, Florida. So what a great job. I got to drive a boat around. But, that team, we're very diverse, and we might not be all of the same type of people that would hang out together, but you got on that boat and you knew people had your back. Like if you went overboard or something got sketchy, everyone was going to come to your rescue. And we had so much trust in each other, and we could work a site in like 15 minutes. We were so effective. We knew what each other was thinking. I've never been on a team like that again, and it was a wonderful experience.
That's a great example, Dina. Thank you for sharing. So now looking back, what do you think helped you build the trust with this group so quickly? Was there anything unique or proactive? Who was a team leader? Was it a culture of trust? Was it strategically enforced?
There was 2 captains on the boat who would trade off. And I wonder if part of it was the high risk environment of working on the open sea.
Right.
You hear about military teams and how they build a lot of trust because there's that
surgical
aspect.
Teams too. The team is not dangerous, but the patient's life is in your hands, right? So you have to be very alert and that culture of safety. So maybe high risk environment kind of requires more trust because you're not going to trust your life to somebody that you don't trust. You're either on the boat or you're off the boat. And perhaps in research, it may be easy sometimes to say, well, what's the big deal? I'm not going to show up for work today, or I'm not going to review that section that I was assigned to do. What's the big deal? There is a next cycle we're going to submit. Sometimes there is no next cycle. So perhaps creating that culture of responsibility and trust, it's something that leaders should think about and plan for, because it may not or may or may not happen naturally. So let's see what
Noyes, can I comment?
Yes, of course.
So I think, and first of all, watching yourself on video is never a fun thing, frankly. And I did not watch this in advance. But here's a couple of things. Till this day, there's a lot of literature that's out there, and I've seen it come to fruition, and I actually still think that it's very, very credible, is that getting people together from an interdisciplinary perspective in the same space is critical. There is no question about it. So what Dr. Connors was just talking about, and what I've seen and what we've all experienced, is that you need to bring people together in order to have them converge and build relationships and be able to work together. And I think, for center grants, everybody does it in different ways. You can do it, virtually, but at the same time, like at least any center application that we put together is talking about bringing people together at least once a year, if it's even involving multi-institution type opportunities. And I think that that's essential. And then just, the recognition of the fact that when you're going after center grants, and it doesn't have to be $50 million, it is just as critical for us to put teams together from a center perspective, even if the funding isn't as significant, but to take advantage of the multidisciplinary perspectives and bringing people together that can actually enhance a collective vision on something, so that it's not just coming out of one school at UB. It's, tapping into the talents of many others. That's where the biggest solutions come from. If you start looking at, how team science or big science came to fruition like 50, 60 years ago, it was because everybody came together in the same room from a lot of different vantages. But so I hope
that's a very interesting thought, Jill. So do you think by moving to Zoom and remote work, we are compromising our ability to sort of use joint intellect? Or could it be generational? Could it be that younger folks, younger than me, may be better and more natural at building connections remotely? I mean, we all got better since COVID. I remember first awkward meetings on Zoom. It was terrible. It's a little less terrible now, but so I would like to hear from people. Is there anybody who finds Zoom meetings more productive than in person when it comes to building collaborations or building trust and partnerships? Are there skilled people like that?
So I think that in order to really build a team and that trust piece and like the collaboration piece, it is more effective if you're together sometimes. But there, the efficiency of Zoom meetings is sometimes nice as well, where you can just quickly jump on, answer questions, see each other sort of face to face. Better than a phone call, better than email. But there is something about being with the people that I still find valuable when I am able to do so.
Thank you for that comment, Kyle. Yes, and so I got really disappointed when NIH study sections moved completely online. Those used to be, it's a very hard work to get in a room with 40 other people and sit there for 2 days straight. But there's so much camaraderie and with so much more insight, and great collaborations were built. And now we do it all on Zoom, and it's absolutely dreadful. I can think of many other examples where we stopped meeting face to face. And don't even get me started on the federal funds not paying for food. So you get together and you have to bring your own coffee, but that's life, right? And so recognizing that while the environment may change, human psychology probably doesn't evolve that quickly. And we should use the best practices that have been developed for millennia for building trust, building partnership, building this delegation infrastructure that will probably benefit your team long term.
I'll be honest with you, Dr. Noyes, and I'm not sure if I shared it in the video, and if you posted it online, so be it. The award has sunsetted at this point, but I had funds in our budget as a result of indirect resources, not direct. Would never fly. And we sort of joke about it to this day, where I had a beer budget to get the postdocs and grad students and early career folk out when we were at an annual conference, so that people would have an opportunity to meet each other and chat and understand not only the talents that they brought from an academic perspective, but who they were. That's part of it. I kid you not, like at the end of BioExfil, I know people were probably, more collaborations were formed and good work was still continuing, but there was a wistfulness of people, not being able to work together as consistently as they had in the past. And that matters, frankly.
Absolutely. I totally believe you. Yes.
Yeah.
And that also goes back to the early slide when we were talking about 7 C's of productive teams. So most of us academics, let's admit it, we tend to be on a more analytical, kind of a dry side. We value ideas over feelings and emotions. But productive teams need different personality. It's great to have somebody on your team who can crack a joke when situations get tense, who can be a little bit lighter but much more social, remember birthdays, remember to bring bagels in the morning. So that's really what interdisciplinary teams are for me. You benefit from variety and heterogeneity of the people on your team. So let's move on.
We have a comment in the chat.
Oh, yeah. So let's get the comment.
Sometimes Zoom has its benefits that participants can put their thoughts in the comments if the conversation is overtaken by another member.
That's a good one. And now that we have AI, you can have a transcript of all the notes, so you don't have to remember and scribble vigorously. So there are definitely benefits. And I think just like with any tool, Zoom is not good or bad. Zoom is only as good as we use it. And if you are skillful at keeping side conversations, keeping the main conversations, keeping the timing, you can use it to your great advantage. And thanks for the comment. So let's hear from Dr. Szczesek about vision and motivation. What motivates people to work on the teams, to be productive and involved on the teams? And how do we create that vision for teams?
Never minimize the willingness of, especially even a Nobel laureate, to want to be able to help with something.
Mm-hmm.
I think that there's a little bit of an intimidation factor. They're never going to want to do this. It's going to cost us too much. How do we go about this? Of the 3 that I worked with, twice I've seen them do things that normal people would have thought, why would they do that? But it was an email, it was a phone call, and they did it. I had a Nobel Prize winner show up in Buffalo in slippers to give a 30-minute talk that we goosed around a schedule for, that he gave his talk, he got back on the plane, and then he went up back out to the West Coast. So I think that if there are times where people have a vision, if they truly are wanting to accomplish something significant, don't count the big stuff out. Think that there's literature that demonstrates that being part of team science or big science, even if you really look at the literature right now, when you look at a paper that comes out on team science, like it could be 70 authors in a particular discipline, and being 35th, like the number on the list doesn't matter as much as the fact that you were part of the effort, and especially a part of a significant effort. So I don't think it's the same challenge that it was 10 years ago. I think that universities, and you'll see that in the literature too, is that everybody's looking at it a little bit differently. We're modifying tenure track or tenure approvals based on, how people have participated in the research environment. And sometimes if team science is the direction that they're heading in and being part of a research unit, that's going to look a little bit different than the individual investigator. So I don't think it's as big of a challenge as it was 10, 15 years ago. At the same time, some universities are facing challenges with keeping up with it, but at the same time, the big research universities have caught on to the fact that we want our people to be part of these groups that are pursuing something interdisciplinary, because we all know, and at the same time, the literature backs it up, that coming at a solution from an interdisciplinary perspective is a more productive solution than what we would see from an individual investigator perspective.
So let's think about behavior of this leader that Jill was describing without naming the person. So they flew to Buffalo just to see their team in person and talk to them about research vision and strategy that they're pursuing. What do you think was the motivation of this individual? So were they really doing it for the compensation? Do they do it because UB was their favorite place, perhaps an alma mater? Did they do it because we all need to be PIs and show some leadership on our CV and that looks good? Or they did it because it's really about communicating your vision and passion, infecting your team with your passion. That's what really drives that person. All right. So I think it's pretty clear that there's not so much variation on this topic. I think that the challenge is to find these people with vision and passion who have strategic ideas, right? And that again goes back to the concept of the team. And I have been a member of many teams where there is a person with vision and passion, but that person may not be a scientist and they can't really write a grant. They may be a member of community or sometimes even patient who had experience with disease or was a caregiver for somebody with disease if we're talking about clinical projects. So it's actually, there are many different combinations of teams where the passion doesn't even come from PI or from the scientist. But you have to have that passion on a team. Somebody who brings you back to why are we doing this? Why are we spending Saturday afternoon revising specific aims? Why is this important? Because all the other things, the money, the CV, they're important, but only to a certain extent. Other thoughts on motivation? How do we make people stay on a team and contribute to the team?
One thing I've found to be quite successful in some teams, when you detect hesitancy, I don't know if I want to do that, I don't have experience in that area, is this is going to be an excellent career skill development exercise for you. You'll be able to put this on your resume, and now that you know how to do surveys, or it would, and I always give people a choice, would that interest you? And usually when you pitch it as a career skill development carrot, I found a lot of buy-in. Oh, that does sound something I'd be interested in.
That's excellent. So it may be only a carrot for some people, but you need to identify a carrot, right? So for junior people, training or a new skill, maybe a carrot. I often find that for community stakeholders, they probably don't need training. They don't need papers, but they want to build closer connection with academic medical center maybe, or bring some expertise or unique knowledge to their community, or publicize what they're already doing, because sometimes we evaluate community practices in our research and make them sort of evidence-based and nationally recognized, whatever that is. But I think what Dr. Connors has mentioned is identifying carrot or multiple carrots and being aware of those carrots. In reality, so I listed these 3 options, A, B, and C, because we think of them as the most natural carrots, right? We want to give back to the community. We want to advance our CV. As an economist, I know that money should be good for everybody if you don't have any better ideas for motivation. Unfortunately, we usually don't have enough money to pay everybody to change their behavior. So it's simple, but not easy to find. But whatever the motivation may be, that can really pull your team together and also creates that buy-in, win-win. You contributing to my team, I'm contributing to your professional development. Jill, were you going to say something?
So the person that came to Buffalo flew across the country, landed for a couple of hours, and went back was Roger Kornberg. He's a Nobel laureate at Stanford. Why did Dr. Kornberg do that? He did it because he believed in the science. So it's closer to D than anything else. Did he want, was it going to, you bring a Nobel laureate in, is it going to build their CV? Absolutely not. No, he was doing it because he wanted to help, and he knew that he could help. He knew that showing up was going to impact the impressions of the review panel and the process. And so that's where, when Dr. Noyes and I were talking about this, I think back in October, never underestimate the generosity of others who have been leading in their fields to want to be able to help continue. And so to reach out to somebody who is extremely accomplished, not because you're going to put them on for 10% or not because you're going to put them on for a month or anything like that, just to be able to help and say, hey, I think this is really critical work. Don't underestimate that, and don't be afraid to ask. I think, I'm not sure because the video was cutting in and out, I'm not sure if that was part of it, but don't be afraid to ask, because they want to see the best outcomes with the research that they've started or that they believe is good for the field that they're situated in.
Thank you, Jill. Yes, and so we often see that because so sometimes you say, well, I don't really have money in my grant budget to invite, I don't know, American Alzheimer's Association as a stakeholder, and we don't ask them. But very often the partners may do it for free because their benefit is something else, not monetary, but seeing their cause being addressed. And that could significantly strengthen any proposal to have Nobel laureate, of course, but have a community stakeholder, to have somebody who developed this methodology that you are using or this measuring tool. So thinking strategically of what could motivate people, and don't just default to money or budget FTE items. Any other thoughts on motivation? All right. So let's talk a little bit about some teamwork practices.
I also do believe that investigators who really have a vision for something, and I've been fortunate over the course of my career to work with 3 Nobel laureates, and probably would have worked with a fourth if he had not passed, because there's a stipulation on that you have to be around in order to be awarded. And especially now, I think, because everybody wants the video on your doorstep we saw a couple weeks ago. But they have a kindness and appreciation for every team member. So they do not treat the administrator in the room any differently than they treat the postdoc, than they treat the co-I or the MPI. And so, and maybe it's just, I was fortunate to work with three that had that in common, but I don't think it's a coincidence. I think that they understood that the research process, and in order to be able to advance something, is not based on an individual. They had vision and they were brilliant. And I think that they all recognized, in what we tried to replicate in all of the things that we did through the center that I ran and through some of the things that we try to do now, is that you can't come into a conversation expecting that just because somebody has their doctorate and many years of training afterward, that they're on the same page and they're speaking the same language, because our fields get so specific at times that it is okay to sit everybody in a room and sit down and say, we're just going to do a quick talk on the basics in every different area. And it's not only, it's fun in many regards, especially if you get them in the same room. That's a beautiful part. If you're able to form a center, or if you're able to put a team together, if you can get everybody in the same space, that's a beautiful thing. But if you can get everybody to a point where they're actually doing a quick talk from the basic level, and they might think it's way too basic, and everybody's nervous about it because they don't want to look, like it's something called peer fear. Like you're embarrassing yourselves in front of your colleagues or your peers. But at the same time, if you can get everybody in the same room and start from the basics, knowing that if you're going to do something from this year, hopefully 10 years from now, you're not only talking to your peers, you're talking to the next generation at the same time. So I think it minimizes the fear factor and minimizes the concerns for it. But that's also essential.
Okay. So what Dr. Szczesek is talking about here is this concept of psychological safety. So this concept of psychological safety is a cornerstone of successful teamwork. And that's why teamwork is not the same as organizational unit. So you could be in a department and be afraid to speak up to your chair, and you're not on the same team as your chair. You can be a member of a faculty. You can respect them and not want to work with them. However, if you're on the same research project and you're fearful of speaking up, this is not going to be a good project. So while organizationally in academic and other institutions, we may still have hierarchical teams where you're told what to do and you report up, that is not a good practice for building teams. And so everything that Jill was talking about, that not assuming that just because somebody is a senior director, they know anything about your field. And you may need to be able to explain the foundational basics of your expertise to anybody in the room. And it could be that the most junior person, maybe the most knowledgeable about technology as always, and we all have to listen to their advice. It's sort of taking off your crown and joining as equals because we're contributing as equals. So it's a psychologically, I totally understand how to do that. Practically, I think we've all been in the situations when it's not easy to do, where you have a big personality in the room and that personality drives the culture. And that again is a strategy for experienced investigators. And I thought this example that Jill shared, that sort of you tell everybody what you do in the very basic terms, and then ask everybody else to explain it in the very basic terms. That could create that sense of camaraderie and lower down the hierarchy a little bit, that people stop using their ego and not introducing themselves as I am the director of 3 centers and 5 institutes, but hi, I'm John, and my role in the project is to make sure that the images are interpreted correctly. So they're figuring out the way. And of course, as a leader, we expected to mirror, to lead that and then to mirror that. So if I introduce myself, in that way, hopefully everybody will follow, and then we can hopefully overcome that complex organizational hierarchy. What do people think? What other strategies have you used that worked for you to get to that same page in the complicated academic environment? Or which strategies clearly should not be used because they create a lot of unnecessary anxiety and hierarchy?
I'll share an example of, I witnessed a leader do this amazing thing in a meeting, and I use it sometimes. So it was a state senator. I was working out west, and she had to convene community members and government toxicologists and everything to talk about a pesticide issue. And, all these different personalities around the table. And she walks in and she sits down. She says, I have one rule, no TLAs. And everyone's looking at each other. What's a TLA? She says 3-letter acronyms. and just I like what Jill was saying about building that shared understanding. I mean, you really can't get any work done until everybody's on the same page. And
Right.
Oftentimes we aren't on the same page. There's so many acronyms, there's so many technical terms. And so I think that's a really good tip I'm taking out of this workshop, is take the time to build that shared understanding.
Yes, that's excellent. Thank you for sharing that. Yeah, and acronyms could be also misleading. You could be an institute director, but on this project, you are epidemiologist, or you are data analyst, or whatever that may be. So our administrative titles don't necessarily correspond with our contribution to each project. Yes, thank you for sharing that. Anybody else has a strategy or a solution to getting to the flat hierarchy on a team? Okay, let's keep the thoughts. All right, so here's another exercise, a little bit more reading. So read carefully. So which of the following scenarios demonstrate the best teamwork practices based on what we've heard in the most recent discussion? So principal investigators values everybody's perspective on the team and doesn't waste any time going over team processes that may be too basic, so that more time could be spent accomplishing the goals of the meeting. Option B, the principal investigator values everybody's perspective on the team and takes time to jointly discuss and establish clarity of roles, processes, and timeline before moving forward. Option number C, the principal investigator focuses on the preferences of the most experienced co-investigators and does not waste time going over team processes that may be too basic, and more time could be spent on accomplishing the goals of a meeting. And finally, D, principal investigator sets the team processes and takes time to make sure everyone on the team understands the basic jargon and each experience before moving forward. So what are your thoughts? Please vote. We miss anybody else? It's 7. I thought we had 8. Okay. Oh yeah. All right. What was 14? Okay. So a couple of people thought that option D was the best practice. Anybody wants to share with us and explain how they think D will be a desired practice. So the difference between D...
We have a hand raised.
Oh, okay. Yeah, go ahead.
Thank you. Well, for me, it was in the spirit of getting everyone to understand the basics of,
The language.
of the language. Like what is just being shared, that you don't want to take it for granted that even the most experienced person in their field is aware enough of what the next person is doing. That was the thinking process. Thank you.
For sure.
Also.
Yeah, so that's a very good point, right? Explaining the language, and we talked about that. So the reason, given the options, and of course, if there are no options, and the D is what they do, and it's a good enough practice. The only caveat here is the principal investigators sets the process without seeking feedback. And there are maybe situations when this is appropriate, when it's a compliance issue and the principal investigator is the only one who is familiar with the requirements, and then they set it up and sort of that's not negotiable because. But the reason the B was the right answer in this case, or the most preferred answer, is that about the specific caveats that takes time to jointly discuss and establish. And that jointly makes a big difference and distinguishes this scenario from other scenarios. But as we said early, all teams are different. And if you're about to jump with a parachute, you may not have time to discuss best practices. You may just want to say to everybody, pull into this ring, and hopefully it will open and save discussion for later time. So again, you match the best practice to your environment, but I just want to make sure that folks captured those nuances in how principal investigators may act and how they may lead various groups. Good? All right, moving on. All right, so this is, I believe, our final vignette that we're going to watch.
Don't be worried about the tenure track process because I think it's coming to resolution. I think universities are continuing to recognize the achievements of teams and the potential, even though that's easier said than done because people are coming in to be successful in their environment. However, to spin that, the bigger responsibility falls on their investigators who are mentoring them to include them in the conversation. If you're forming a center, you had better gosh darn have a plan for postdocs and graduate students. You had better find a way to train them in an interdisciplinary way and let them start talking to each other across units, across institutions, across disciplines, across labs. And so I think the more heavy responsibility from what I've seen, which to date was an extremely successful environment in the National Science Foundation space, and that they will attest to as well. You engage them. It's like you can't go into this and think that you're trying to solve something of significance without thinking about training the next generation. So I think the onus is not on the student, not on the postdoc. I think it's on the investigator to make sure that they're engaging the right people in the conversation. You need to pay for them to get to conferences. We had an annual meeting every year, and was there a cost to bring them together? Yes. Did I have to pay for beer at a bar in Puerto Rico for the education director to bring them all together? Yes, I did. And it was off the books and it was indirect costs and stuff like that. But you have to find ways to get them there. And you can't leave them out of the conversation. They have to be just as much present and realize you're not presenting to your peers and you're not presenting to, all the people that you aspire to be within your field. You have to be training.
I wish I was on your team, Jill. But
don't be worried about the tenure track.
When I was a graduate student, that was a culture to bring graduate students to the meetings and to introduce them to everybody who was way senior than them, but just to give them opportunity to practice their elevator speech, give them an opportunity to listen to a discussion between different PIs when they're negotiating a new grant or roles of different people in the grant. So the good news is that team skills are learned behaviors. Just like we let kids play in the sandbox and make sure they don't throw sands in the eye of another child, you have to practice that and know if you don't behave, somebody's going to smack you with a little truck or doll or whatever, little shovel. So same as a price of academic misbehavior. You're not going to get invited. You're not going to be selected. But modeling teamwork for our trainees and junior faculty, and then being mindful and strategic in designing research space. So that goes back to the question, do we meet in person or do we meet online? If we meet online, let's allow for communication or encourage people to trade in the chat their information and to introduce themselves. So I see more and more of those strategies of team building on Zoom have been shared in various settings. But they have to be strategic and not accidental thoughts that, well, maybe you meet by the water fountain, maybe not. So let's think of different strategies that can create a team supportive environment where we can learn better and practice our team skills. So when the opportunity comes, we actually have some expertise. And the options here, again, to keep trainees silent, to reduce disputes about authorship and whatever that may be, to enforce promotion and tenure guidelines that encourage individual-based merit and discourage team collaboration because it's a waste of time, as I often hear, model an environment that openly shares resources, credit, intellectual credit, and decision-making, and integrates trainees into multiple PI projects. And alternatively, direct trainees towards research questions that they could easily and quickly solve by themselves. Okay? No big surprise here. Fantastic and excellent participation. But I imagine you've seen all of the other options, A, B, and D, being very often used because they seem easy, they seem faster, but it's the return on investment that makes option C so much valuable. Yes, it's faster today, but in terms of building a career, you will not be able to succeed beyond a certain point of being a postdoc or junior faculty if you haven't built those skills, if you haven't built the collaborations, if you don't know how to negotiate authorship or grant percent effort and with other investigators. And that's actually going to slow you down later on. Any last words of wisdom or any other strategies that folks would like to share that worked really well for them in various team-based environments?
Can I be the administrator here right now?
Yes.
There are resources on campus for people who are submitting for center team-based opportunities. So you should all be aware of that. If you're going to go in for a center submission, an NIHP, a T, a PCORI, an NSF, STC, the campus will support you to the effect where they can actually contribute resources that you might not be permitted through the award itself. So never forget to think about working with your administrator who's helping you prepare or to go out and get that sort of funding. And the last thing that I would say, Dr. Noyes, you're really good at this. Like, I mean, honestly, I remember that conversation. I was sitting in a hotel room down in DC while we were doing this because I was at a Core meeting, and like what you distilled, and frankly, I talk way too much, but was amazing. And so you're so good at this. But I think the only other thing, and I don't know if I didn't see the beginning of all of this because I was doing Willy Wonka practice at the elementary school. So that's why I was late. But at the end of the day, team science is so fun. Like when you build a team and you think about the impacts of like what can happen as a result. Like I am a social scientist all day long. I have an elevator speech on X-ray free electron lasers and what they can do. And when you get everybody singing the same song across something, it's fun and it's gratifying and it's a beautiful experience. So I hope that all of you that are listening and are thinking about doing something in this perspective, like, you know, you should have the backup and you should have the enthusiasm of the people around you. So.
Thank you very much, Jill. This is very, very important message because you all know that the reality of academic career could be very harsh. You get rejections all the time. The funding rate is so low. Your papers get rejected. There's plenty of opportunities for negative. But in order to stay sane, in order to stay motivated, not to burn out, you just psychologically need that peer support. That's probably one other thing about teams that we didn't talk about, that having that support really can help deal with rejection, deal with bad scores, deal with failed experiments, and have stamina and energy and optimism to do it over and over again. So that's really the foundational benefit of teamwork in research. Thank you very much, Dr. Szczesek. And my final comments on this was that the favorite expression I have about teams is that the team of stars, it's not always a star team. Big egos and big personalities may not necessarily lead to productive teamwork. So we talked a lot about big scientists, but you don't need 5 big scientists. You may need 1 big scientist who will open some doors and provide innovative ideas. But you also need a lot of hardworking people, motivated people, people who know how to dot the I's and cross the T's, who know and understand compliance, budgets, negotiations, and a lot of other diverse skills. Another important thing that I learned, that as much as I want to move fast because a deadline is approaching or because there are many other grants you want to write, fast may not favor team performance. You may lose some people along the way because they're confused or because they didn't understand why the rush was. And so allowing enough time for the team to gel, for directions and vision to clarify, to hear the feedback, to allow normal human psychology to gel, generally results in a better long-term team performance. And again, if you have a one-time team, if you perform at a conference and you're never going to talk to each other again, which is very rare, but in that situation, the long-term investment may not be as important. But for most research collaborative and collaborative with community stakeholders, we are looking for long-term investment. And then we want to be extra mindful of all of those key milestones that teams have to go through. And I can't emphasize enough that just research methodologic expertise is usually not enough for productive teamwork. And Dr. Szczesek, I think, provided multiple examples and illustrated beautifully how in many situations it's the extra creativity, it's the thoughtfulness, it's the other human skills and experiences that pull you out or make you cross the finish line just as much as the sample size and the p-value and all of the other technical skills that we drill our graduate students on. My final comment is that size doesn't substitute for quality. Having a large team of people who don't fit together and don't have the right expertise is not going to help you in reaching your goals. So it's a very careful and mindful selection of personalities, expertise, skills, and knowledge that aligns with the project goal. That's what brings the best outcome. So even if it's your most favorite, I guess you're not going to play hockey with your favorite football team, right? It's that kind of thing. So select the team for the purpose and be realistic about not playing with everybody on the same team. That's, if you look at the early diagram that I show in the beginning, when you need a team. Joining a team is a perfectly natural experience. It should not be interpreted as a sign of failure, because you work with different people for different purposes. So I will stop here and remind you that there are many more opportunities for training and new knowledge, and that we're always happy to see you. And Liz and Catherine can help you sign up and identify what you need. And we're happy to see you and take any questions.